Hello students, in the previous lecture we have discussed about the drug price control order. So, what is drug price control order? Under the Commodities Act we have established an order which is called as drug price control order. So, now we will be studying here in the continuation of that lecture, we will be studying here about the pricing policy which has been set up by the drug price control order NLEM, that is National List of Essential Medicines. With the help of this lecture or after the completion of this lecture, you will be able to come to know about the pricing policies, about the pricing of the formulations which has been covered under the Drug Price Control Order 1995, National Pharmaceuticals Pricing Policy 2012 and National List of Essential Medicines we will be coming to know about here. So, in the previous lecture we have discussed drug price control order क्या होता है, what are the different objectives of drug price control order. We have discussed many definitions related to the drug price control order like active pharmaceutical ingredient, brand, generic version of medication, as well as scheduled formulations, non-scheduled formulations, ceiling price, maximum retail price, etc. Then after the objective, after the study of definitions, we have studied some directions which has been given by the central government for maintaining the drug price control order. Then after, we will be studying here about the pricing policy which covered under the drug price control order 1995. So, pricing of the formulations which covered under the drug price control order, it is like under the 1995 drug price control order, the prices of the scheduled formulation which are also specified in the first schedule to the drug price control order 1995, which are fixed and notified under the provision of said order up to 31st May 2012 shall remain effective for further 1 year, that is up to 30th May 2013. तो जब भी कोई नेशनल लिस्ट ऑफ एसेंशियल मेडिसिन या प्राइसिंग ऑफ द फॉर्मुलेशन को हम इशू करते हैं तो इट विल बी applicable for the provision of 1 year only. It means from if it has been issued on 31st May 2012, then it will be applicable till 30th May 2013. So, 30th May 2013 ko we need to publish another list of essential medicines, and the manufacturer may revise the price of such a scheduled formulation as per the annual wholesale price index for the provision for the previous calendar year announced by the Department of Industrial Promotion and Policy, and thereafter the formula as in sub paragraph 1 of paragraph 4 of this order shall be applied for fixing the ceiling price of such formulations. How we have calculated about the part of the ceiling prices, that part will be including here, and we have discussed about the para 1 and para 4 there also in the last previous lecture. So, that is the discussion continued here, that the price of a scheduled formulation which are also specified in the first schedule. What is first schedule? That schedules we will be studying in this lecture. There are two schedules which has been developed under the National List of Essential Medicine passed by the Drug Price Control Order. There are two schedules, Schedule 1 and Schedule 2. Schedule 1 में या first schedule में different conditions or the diseases or the drugs are mentioned, as well as in Schedule 2 there are some 5 type of forms are there which we need to fill for the drug price control order. So, the price of the scheduled formulation which are specified in the first schedule of the drug price control order 1995 are fixed and notified under the provision of the said order up to 31st May 2012 and shall remain effective for further 1 year, that is up to 30th May 2013, and the manufacturer may revise the price of such a scheduled formulation as per animal wholesale price index for the previous calendar announced by the Department of Industrial Promotion and Policy, and thereafter the formula as in sub paragraph 1 of paragraph 4 of this order shall be applied for fixing the ceiling price of such formulations. Then pricing of the formulation which has been covered under the drug price control order is immediately thereafter the manufacturers may revise the prices immediately after when the manufacturer revise the price as per the annual wholesale price index for the previous calendar year announced by the Department of Industrial Promotion and Policy, and on the 1st April of succeeding financial year, the formula as in subparagraph 1 of paragraph 4 of this order shall be applied for fixing the ceiling price of such scheduled formulations. In the previous lecture, we have discussed the formula, how to calculate the ceiling price, how to calculate the average price, how to calculate the retail price, and how to calculate the maximum retail price. That all the things comes under the subparagraph 1 of paragraph 4. So, that's same as we need to apply it here for the calculation of ceiling price. Then come to the part of the National Pharmaceutical Pricing Policy. तो नेशनल फार्मास्यूटिकल प्राइसिंग पॉलिसी जो है it lies under the drug price control order and the drug policy of 1944 as implemented through the drugs price control order 1995. सबसे पहले we have established a drug policy. That drug policy is known as now National Pharmaceutical Pricing Policy. So, drug policy which has been prepared in 1994 is known as the drug policy which has been implemented through the drug price control order 1995, which was introduced, and the principle for price control broadly adopted in this policy, which has been represented as a radical departure from the earlier policies, as well as the drug policy of 2012, however, challenged in the Karnataka High Court, which by order dated 12/11/2002, means on the 12th November 2002, issue a stay on the implementation of this policy. This order was challenged by the government in the Supreme Court, which vacated the stay wide its order dated 10/3/2003, that is on 10th March 2003. So, once that drug policy was introduced, it has been challenged by the Karnataka High Court by the order on dated 12th November 2002, as well stay has been held on that particular policy on 10 March 2003. Then, in the light of this order by the Supreme Court, it was decided that a fresh pharmaceutical pricing policy will be formulated. Means here, after getting challenge from the Karnataka High Court in 2002, that is on the 12th November 2002, they have put a hold, means the government or the Supreme Court has put a hold on that particular policy on 10th March 2003, and after that government has decided, or on the basis of the Supreme Court, what the order has been given by the Supreme Court, that to revise the national pharmaceutical pricing policy. So, in the light of order which has been passed by the Supreme Court, it was decided that a fresh pharmaceutical pricing policy will be formulated, and accordingly the drug policy was never implemented, and 1994 drug policy continued to be applicable and continued till 2012. So, जो भी drug policies थे, that has been implemented of the 1994 only, there were no changes has been done. Further, in accordance with the guidelines which has been provided by the Supreme Court above, the Ministry of Health and Family Welfare revised the list of medicines in the National List of Essential Medicine earlier and notified in 1996. So, after getting order from the Supreme Court, after getting the guidelines of the Supreme Court, the Government of India under means the Ministry of Health and Family Welfare under the Government of India has revised the list of medicines again under the National List of Essential Medicines and has been informed or notified in 1996. So, the revised list was notified as National List of Essential Medicine 2003. In November 2004, the government also set up the task force to look up into the issue of price policy option other than price control and other issues, and to make recommendation for making available life saving drug at reasonable prices, as well as the basis of the drug will be considered was the NLEM 2003 being the latest list at that time. and the committee submitted its recommendation in September 2005. In 2011, the government revised the national list of essential medicines and notified the new national list of essential medicines in 2011. So, this is all about the national list of essential medicines. As well, again the revised list was notified as national list of essential medicine in 2003, and it has been notified under the, again it has been revised in 2005, 2011, and then it will be called as the NLEM 2011, which has been notified by the government. Then there are national list of essential medicines. So, in the national list of essential medicines there are two schedules. So, national list of essential medicines जो है it is divided into two schedules, that is schedule 1 and schedule 2. तो national list of essential medicines जो है it has been passed by the government of India and it has been called as the national list of essential medicines, which has been notified as National List of Essential Medicine 2011. Then National List of Essential Medicines is basically divided into two parts, that is Schedule 1 and Schedule 2. Schedule 1 is consist of 27 sections which contain different type of categories of drugs which falls under National List of Essential Medicines, as well as Schedule 2 is comprises of 5 type of forms which are related to National List of Essential Medicine. So, we need to remember that National List of Essential Medicine is basically divided into two schedules, that is Schedule 1 and Schedule 2. Schedule 1 is consist of how many sections? It is consist of 27 sections of different kind of categories of drugs which falls under National List of Essential Medicines. Essential medicines, life saving drugs, which falls under these 27 sections, and schedule second, it comprises of 5 types of forms which are related to National List of Essential Medicine. So, there are the categories which has been shown in this slide, that is schedule 1 के अंदर there are 27 sections. Okay. तो schedule 1 के अंदर 27 sections के these are the different categories which has been shown over this slide. So, in schedule 1 the category is anesthesia, second category is non-steroidal anti-inflammatory drugs, category third is anti-allergic or the drugs which could be used under anaphylaxis, then antidotes of the different poisons, then fifth section under the DPCO or under the National List of Essential Medicine is anticonvulsants, as well the sixth section under the Drug Price Control Order National List of Essential Medicine is anti-infectives. Anti-infectives including any kind of infections which is caused in the biological system, as well. Seventh category is anti-migraine. Eighth category or the eighth section of the schedule 1 under the National List of Essential Medicine is anti-neoplastic or immunosuppressive. Ninth section of the schedule 1 under the Drug Price Control Order or the National List of Essential Medicine is anti-Parkinsonisms, as well. The drugs which affects the blood or the medicines which affects the blood lie under the schedule 1 of the section 10. Then blood products and plasma substitutes, whatever the products or the products related to the blood or the plasma which we use comes under falls under the schedule 1 and section 11. Then cardiovascular medications, all the different kind of cardiovascular medications lies under the 12th section of schedule 1 under National List of Essential Medicine. So, in this slide we have shown 12 sections under the schedule 1 which is related to the anesthesia, NSAIDs, then anti-allergic and the drugs which are used for anaphylaxis, then antidotes, anticonvulsants, anti-infectives, anti-migraine, anti-neoplastic or immunosuppressive, anti-Parkinsonisms, medicines which could affect the blood, blood product and plasma substitutes, cardiovascular medications. As well, another 13th section under the Schedule 1 of National List of Medicine is dermatological medicines, the drugs which are related, which used to treat for the skin purpose, or the topical preparations which falls under the section 13th of the Schedule 1 under the National List of Essential Medicine. Then 14th section is having a diagnostic agents. Diagnostic agents means whatever the ultrasounds or the x-rays we used to do. So, we use different kind of gels, different kind of liquids we used to put on the part on which the ultrasound will be diagnosing. So, during that time we use diagnostic agents which could easily diagnose the thing in our body. So, that comes that falls under the section 14th of the Schedule 1 of National List of Essential Medicine. As well as 15th section of the Schedule 1 is disinfectants and antiseptics. Section 16 is diuretics. Diuretics under the section Schedule 1 in the section 16th of National List of Essential Medicine. Then gastrointestinal medications. Gastrointestinal medications falls under the section 17th of Schedule 1 under National List of Essential Medicine. As well, hormonal medications or endocrine medications, endocrine medicines, which falls under the 18th section of the Schedule 1 of National List of Essential Medicines. Then section 19th contain immunologics under the National List of Essential Medicines. Under the DPCO National List of Essential Medicines, muscle relaxants are there. Then under the section 21st, ophthalmologicals are there. Then under the section 22nd, oxytocin, as well as 23rd section, peritoneal dialysis solutions, as well as psychotherapeutic agents, or the psychotherapeutics lies under the 24th section of the Schedule 1 under the National List of Essential Medicine. Then section 25th related to the respiratory tract medicines, whatever the different respiratory disorders are there, so that kind of medications are involved in the section 25th of the Schedule 1 of National List of Essential Medicine. Then section 26th, which is having the solution for water electrolyte and acid base disturbances. So, to control over these kind of disturbances, that kind of the drugs falls under the section 26th. As well, section 27 under National List of Essential Medicine contains vitamins and minerals. So, these are the 27 sections which includes in the Schedule 1, or which make the Schedule 1. As we have discussed earlier, that NLEM is basically divided into two schedules, Schedule 1 and Schedule 2. So, Schedule 1 consists of 27 sections, which we have studied here from Schedule 1 to Schedule 27. Then another is Schedule 2. So, Schedule 2 क्या है? Schedule 2, there are 5 type of forms which are comes under the Schedule 2. Schedule 2 में 5 टाइप के फॉर्म्स लाइज करते हैं. तो अकॉर्डिंग टू द ड्रग प्राइस कंट्रोल ऑर्डर अंडर द नेशनल लिस्ट ऑफ एसेंशियल मेडिसिन इन Schedule 2, Form 1 is having a performer for application for price fixation, revision of a new drug formulation related to National List of Essential Medication या medicine formulations. Means whoever the manufacturer or whoever want to fix the price of a particular drug, that form or the application format comes under the Form 1 of the National List of Essential Medicine. Or if you want to revise the price of any kind of formulation, any new drug formulation, then also we need to apply for the Form 1. Then under the Schedule 2 of National List of Essential Medicine, it is having a performer for submission of revised prices for scheduled formulations. ठीक, तो फॉर्मुलेशन scheduled formulations का यदि हमें रिवाइज प्राइस करना है, प्राइस को रिवीजन करना है, then we need to apply for Form 2 which lies under Schedule 2. As well, Another is Form 3rd. Form 3rd is related to the performa for quarterly return in the respect of production, import and sale of NLEM, that is National List of Essential Medicines. Form 3 contain performa for quarterly return, means whatever the turn is there, whatever the return is there from that particular product, that all the details of that particular product, production details, import details, sale detail related to the essential medicines is needed to be filled under the Form 3rd, given under the Schedule 2, lies under the Schedule 2 of DPCO with National List of Essential Medicines. Then Form 4th under the Schedule 2 of National List of Essential Medicine, that is Form 4th, performa for submission of the details in respect of discontinuation of the production and or import of scheduled formulations. As well, there are Form 5th. Fifth form is related to the performa for price list. Whatever the price list is there, so that price list is needed a performa, needed a format. That format we will get from the Form 5th under the Drug Price Control Order. So, these are the 5 forms which we require: Form 1, Form 2, Form 3, Form 4 and Form 5th, which all the forms lies under the Schedule 2 of National List of Essential Medicine. So, once again, in the previous lecture we have discussed what is Drug Price Control Order, we have discussed about the Essential Commodities Act. So, according to the Essential Commodities Act only DPCO has been framed. So, Drug Price Control Order, then after we have studied the different objectives related to the Drug Price Control Order. Drug Price Control Order के objectives के बाद we have studied about the Drug Price Control Order के कुछ guidelines we have studied which has been specified by the Government of India, which has been specified on the Official Gazette of India. Then after we have studied about the different definitions like brand, generic version of medication, or like active pharmaceutical ingredient, scheduled formulations, non-scheduled formulations, etc. Then after we have saw that how to calculate a particular price of a drug, either ceiling price, retail price, maximum retail price, average price, that all we have saw in the previous lecture. And in this lecture we have continued with that particular part. We have set here pricing of the formulations covered under Drug Price Control Order. We have saw National Pharmaceutical Pricing Policy 2012, and we have studied about the National List of Essential Medicines. So, here we have first we have saw that what is the criteria for pricing of the formulations covered under the Drug Price Control Order 1995. So, the prices of the scheduled formulation which are also specified in Schedule 1 to the Drug Price Control Order 1995 fixed and notified has to be under 31st May 2012 and shall effective till 30th May 2013, and the manufacturer may revise the price of such schedule formulations as per the annual wholesale price index for the previous calendar year announced by Department of Industrial Promotion and Policy, and thereafter the formula as in subparagraph 1 of paragraph 4 of this order shall be applied for fixing the ceiling price of such formulations. Then pricing of the formulation which covered under Drug Price Control Order 1995, immediately thereafter the manufacturers may revise the price as per the annual wholesale price index for the previous calendar year announced by Department of Industrial Promotion and Policy on the 1st April of succeeding financial year. The formula as in subparagraph 1 of paragraph 4 of this order shall be applied for the fixing the ceiling price of such scheduled formulations. Then we have here studied about the National Pharmaceutical Pricing Policy. National Pharmaceutical Pricing Policy was represented as Drug Policy of 1994 and has been implemented through the Drug Price Control Order 1995 and was introduced, and the principle for price control broadly, which has been adopted in the policy, which is represented as a radical departure from the earlier policies, whereas Karnataka High Court has challenged in 2002 and that order has dated 12/11/2002, which is issue a stay on the implementation of this policy. Whatever the drug policy has been prepared, they have put a stay on the implementation of this policy, and the government or the Supreme Court has decided to stay it till 10/3/2003. Then after, in the light of the order which has been passed by the Supreme Court, it was decided that a fresh pharmaceutical pricing policy will be formulated, and accordingly the drug policy was never implemented, and in 1994 drug policy continued to be applicable and continue till 2012. As well, further in accordance with the guidelines which has been provided by the Supreme Court above, the Ministry of Health and Family Welfare revised the list of medicines in the National List of Essential Medicine, earlier notified in 1996. Then the revised list which has been revised, that revised list was notified as a National List of Essential Medicine 2003 in November 2004. Then government also set up the task force to look into the issue of the price control. As well, we have studied about the National List of Essential Medicines. That National List of Essential Medicine is divided into two parts, that is Schedule 1 and Schedule 2. Schedule 1 is consists of 27 sections which contain different kind of the categories of the drugs which falls under the National List of Essential Medicines. As well, Schedule 2 is comprises of 5 type of forms which are related to National List of Essential Medicines. Then we have saw that what are that 27 sections. So, there are 27 sections which has been comes under the Schedule 1 of National List of Essential Medicine under the Drug Price Control Order. So, Section 1 is anesthesia, the drugs which are related to anesthetics. Number 2, the drugs which are related to non-steroidal anti-inflammatory drug. Third section, anti-allergic or anaphylaxis. Fourth section is related to the antidotes. Fifth section is related to the anticonvulsants. Sixth section is related to the anti-infective drugs. Seventh section is related to the anti-migraine drugs. Eighth section is related to the immunosuppressive or anti-neoplastic drugs. Ninth section is related to the anti-Parkinsonism drugs. 10th section, medicine after affects blood or plasma substitutes. Then 12th section related to the cardiovascular medicines. 13th section is related to the dermatological medications. Like that only we have divided it in 27 sections. Then we have studied about the Schedule 2, which contains 5 type of forms. Form 1, which is related to the performa for application for price fixation, revision of a new drug formulation related to NLEM formulations. Then we have studied Form 2, which is related to the performa for submission of revised price for schedule formulation. Form 3rd, 4th and Form 5th is related to the price list. So, this is the reference which we have taken, that is Jain NK, a textbook of forensic pharmacy. Thank you.